In Uganda, health statistics show that 1 in 23 children die before they make 1 year, and 43% of deaths occur during the neonatal period. One of the leading causes of death in newborn children include birth asphyxia, a condition where a baby is tired, and hypothermia, where a baby has low body temperature.
So once the baby is born tired, everything in the organ in the body is tired. So the brain is tired, the stomach is tired, the heart is tired, the kidney is tired, the liver is tired. So that is birth asphyxia. Birth asphyxia is one of the major causes of death amongst newborn babies. It's the leading #1 cause of death among newborn babies.
Nakasero Hospital is now collaborating with international children care centers to train Ugandan nurses and neonatal doctors in both private and public health facilities to acquire new skills and techniques on how to care for their newborn babies.
Or sometimes you could have complications in the baby or in the complications in the mother. For example, if a mother has abnormal bleeding or an abnormal placenta that easily bleeds, that means the baby is not going to get sufficient oxygen while it's in the womb. That can be also associated with asphyxia. Sometimes when the placenta dislodges, that can be associated with asphyxia. Or sometimes the baby may be big and cannot pass through the mother's birth canal. So as she struggles to be delivered, there may be delays, and that can also cause birth asphyxia.
Dr. Dixon Tumusime, the head of Department Neonatal Care at Nakasero Hospital, says Hypothermia Treatment Center is being constructed to help improve newborn survival and care.
The treatment center that we are starting at Nakasero Hospital is called therapeutic hypothermia for babies that have had birth asphyxia. This intervention, we cool babies. The normal temperature for a baby is usually between 36 to 37, but during this intervention, we cool babies to a temperature of 33.5 degrees Celsius for a period of 72 hours. And that is what we are launching today.
The Permanent Secretary in the Ministry of Health, Dr. Diana Atwine, commended the initiative of improving newborn care by Nakasero Hospital.
Preterm babies, we are losing many babies. First of all, that process even of transporting them from wherever they are to the hospitals for ICU management or to access incubators is one of the biggest challenges. So when we are here to talk about how we can manage effectively and to train our teams in the country to manage hypothermia, especially in those hypoxic patients, especially the children who develop even further the encephalopathy. It is very, very welcome.
For long, Ugandan government has been concerned about neonatal deaths, and different interventions have been put in place, including encouraging mothers to deliver in hospitals and provision of resuscitation devices to health facilities. Adia Nakote, UBC.